Good morning, it's Dr. Beebe back again with another version of Medical Monday. I want to talk about some principles of gastroenteritis or a stomach virus. The first thing is it's common to see fever and rash with this illness. The rash tends to be more at the end of the illness, but vomiting phase is first, and it can be difficult because they just keep vomiting. So there are some tricks that you can do to try to get fluid in your baby when they want to vomit all the time. The first major concept is just sips of liquid. And we try to do clear liquid, not milk if possible. And that would be for a little infant, something like Pedialyte. We always love breast milk in all situations, including gastroenteritis. So if you're nursing, keep nursing, because your breast milk has antibodies which will help the baby get better. So it is kind of a double-edged sword. But those babies that are just out of the nursing range, we want to go ahead and try to do either Pedialyte or Gatorade, just wetting their mouth, just a sip, a straw full at a time, to kind of just trick the stomach into not throwing up. When they do vomit, you want to wait for about a half an hour, let their stomach rest, and then go ahead and start trickling it in again, okay? Now, as soon as they're able to tolerate a few mouthfuls, maybe then you advance to an ounce and they keep that down, maybe to 2 ounces, they keep that down. Then you try to advance a little bit more volume, and if they don't throw up, then I want you to give them a couple of bites of food. So it does help us to get a little bit of food in when we have a stomach virus. Not a lot, but a couple of bites, because we want to keep this illness moving through and to pass through our gut. So one of my first things that I would offer would be like maybe a bite of Jell-O or a little popsicle to chew on. Maybe we would advance, if they tolerate that, into what we call the Brat, B-R-A-T, Brat diet, which bananas, rice, applesauce, toast, very bland foods, no dairy. We're going to avoid dairy for a few days. One of the things you're going to see in the stool, and this is very important, you have to pay attention to their stool. If their poop starts looking green, you're fine. If their poop starts looking red or bloody, then you definitely need to be seen. If we start seeing bloody stool, we start thinking not a little viral stomach bug, but probably something like salmonella or a bacterial infection. Secondly, abdominal pain is intermittent with a stomach virus. It shouldn't be a long period of pain. You might see 20 minutes of them uncomfortable, but you're not going to see them curled up in a ball for an hour whining. That's not okay, and that would definitely be something we need to see. So one little trick with fever when you have a stomach bug is you can use a suppository and treat them that way, and sometimes really relieve that fever and make them more likely to want to eat something. So just a few tricks and a few thoughts on the stomach bug, because it is in our community for the past few weeks, and I hope you don't have to deal with it. But if you do, those are some really good tips.